Today I'll be providing ostomy care for my patient. Before I go in and see my patient, I'm going to go ahead and check my physician orders to make sure that I have all the information necessary and make sure that I know the reason why my patient is getting this procedure done. So once I have all my information about my patient, I can go ahead and see them. So I'm going to go in, knock, knock. Hi, my name's Natalie. I'm a student nurse, and today I'll be performing ostomy care, okay? So I'm going to go ahead and perform hand hygiene. Close the door and make sure that I have adequate lighting. And then I'm going to go ahead and assess my patient's wristband. Can I get your first and last name and your date of birth, please? Okay, great. Thank you. So once I have that information, I'm going to go ahead and position my patient. Would you like to be sitting up more or laying down a little bit more? Laying down a little bit more? Okay, so I'm going to go ahead and adjust my patient. And I'm going to go ahead and raise the bed up to a good working position. And then I'm going to go ahead and perform hand hygiene and get some clean gloves on. So how are you feeling today? Feeling okay? All right, it's going to be a quick procedure, okay? Let me know if at any point during this procedure you have any questions, do you feel any pain or discomfort, okay? All right, so we're going to get started, okay? I'm going to have all my supplies ready, and I'm going to go ahead and have my graduated cylinder and have a chuck pad underneath to prevent any other things from getting soiled. And then once I have my chuck pad underneath, I'll have my graduated cylinder, and I'm going to remove the tape here, undo the bag, and I'm going to dump the contents of the bag into my graduated cylinder. Okay, so now all the contents are out. I'll have go ahead and measure how much was in the graduated cylinder, and I'm going to assess the content within as well. So is it liquidy? What color? Is it green? Green and liquidy would be the most common and the most within normal ranges. So once I have this, I can go ahead and set it aside or dump it out once I have that documented. So I'm going to go ahead and remove the bag. So I'm going to be very gentle because if it's very adhered to the skin, it could rip the skin or cause skin damage, and we want to maintain skin integrity. So just let me know if you feel any pain, okay? And I want to do the push-pull. So I want to push while I'm pushing against the skin. And we can use adhesive dissolver if the adhesive on the old application does not want to come off. So I'm going to go ahead and dispose of this in the trash. Okay, so now that we have that off, I'm going to go ahead and have some wipes ready at home. You can use some toilet paper, water, anything that helps get any stool off, okay? So I'll have my wipes ready and I'll wipe around the area. Do you feel any discomfort or pain? No? Okay. So I'm cleaning the area. Okay, so once that is done, I can go ahead and dispose of that in the trash. I have a clean stoma now, and I'm going to assess. I want to make sure that it is a dark pink or a red and that it appears moist. I want to check the surrounding skin as well, if it's intact, if it's irritated from the adhesive. Another thing I want to make a note of is the size of my stoma. A new stoma could be protruding a bit more out than in older stoma. So it could be the normal for an older stoma would be half to an inch and half an inch to an inch, and an older stoma or a newer stoma could be up to 2 inches in protrusion. So I've made a note of all the information I need to know about my stoma, and I'm going to go ahead and I also want to check if there's any bleeding. A newer stoma could have a little bit of bleeding, and that'd be normal. And for an older stoma, just make sure that there's not a lot of excessive bleeding. I want to assess for any signs of infection as well. So once I have all that, I'm going to go ahead and prepare my patient for the new application. So I want to make sure that the area is dry, and I can apply some skin protectant so that when the new application goes on, it's not harsh on the skin and we maintain skin integrity. So I'm going to go ahead. Would you like some skin protectant on? Yeah? Okay. So I'm going to go ahead and apply the skin protectant. And I also want to make sure that that dries before I apply my new application. So when applying my new application, I want to make sure that I measure it. So I'm going to measure my stoma, and then I'm going, when I cut the area, I want to add about 1/8 of an inch more. So once I cut that and it's cut out, I want to go ahead and smooth out the edges with my finger so that it's an easier application. And I'm going to go ahead and apply it on my patient. Attached, I would have the bag. So I'll go ahead and attach my patient carefully. And then I want to apply even pressure on both sides for about 30 seconds just to make sure that that application is on correctly and that it won't move around. So I would go ahead and have that on. And then I want to make sure that the bag is pointing downwards. The tip of the bag is pointing downwards and not any other direction, because when we have to empty it again, we want it to be an easier way to get the content out and it's not making a mess. So once that application is on, I'm going to go ahead and ask my patient, how are you feeling? Are you feeling any pain? How are you tolerating this procedure? Feeling no pain? Great. So usually it's changed from 3 to 7 days, and it's emptied when the bag is about half full. So that's some things I want to tell my patient. So once that is done, do you have any questions? No? Okay, you feeling all right? Sounds good. I want to make sure that that bag is sealed, that I push all the air out first and I seal it. And then once that is all done, I can go ahead and clean up all my supplies and document. So I'm going to go ahead and take my gloves off, perform hand hygiene. I'm going to lower my bed again all the way to the lowest position and ask my patient, would you like to be sat up more, or are you okay, or lay down more? You're okay where you're at? Great. So let us know if you have any questions. Here's your call light. The red button is to let us know if you need anything, okay? Sounds good. After I leave my patient, I'm going to go ahead and document everything else, make sure I dump out what was ever in the graduated cylinder after I have measured how much was in it. And that is all.